Morning viewer, welcome to our FTB English. Viewers, a study led by biomedical scientist Erika Henrich at the University of California, Riverside highlights a critical gap in how clinicians detect and treat a breathing distress that is called the dyspnea, particularly in patients on ventilators. The research is published in the journal Respiratory Physiology and Neurobiology. Dyspnea, yeah, the medical term for a breathing discomfort or shortness of breath, is often hard to recognize. According to Henrik, it's often very difficult to tell when a patient is experiencing breathing discomfort, and current clinical approaches may be overlooking it. In controlled laboratory experiments with nearly 70 healthy participants, Henrik's team induced dyspnea by carefully adjusting oxygen and carbon dioxide levels. While both gases influence breathing, the findings point to carbon dioxide, not oxygen, as the most significant driver of the sensation of breathlessness. This challenge, a common clinical practice, said Henrik, an assistant professor of biomedical science in the UCR School of Medicine. Clinicians often rely on oxygen saturation in the blood to assess patient, but oxygen levels are often a poor predictor of how breathless someone feels. Carbon dioxide is a much more important driver of this sensation. The work reinforces growing evidence around silent hypoxemia, a condition in which patients have dangerously low oxygen levels without feeling short of breath, or conversely feel severe distress despite normal oxygen readings. The work aims to produce a predictive tool that can help clinicians predict and continuously monitor breathing comfort in patients. And it will use a machine learning algorithm to detect dyspnea from non-invasive biomarkers. Viewers, even more concerning, outward signs of distress or lack thereof can be misleading, Henrik said. We found that sometimes the person who looks the calmest reports the most distress, she said. Where subtle cues that appear like anxiety, such as darting eye movement, may reveal more than visible breathing pattern. For patients on mechanical ventilations, the stakes are especially high. Ventilators often use low tidal volumes, small breaths to protect the lungs from injury, but this can intensify the sensation of breathlessness. In some cases, patients who are sedated or unable to communicate may feel as though they were suffocating. So this can be truly terrifying experience, Hendrik said. Patients describe feeling like they are dying, but they cannot communicate and no one realizes what they are going through. Because such experiences can have lasting consequences. High rates of post-traumatic stress disorder have been documented in patients after ICU stays involving mechanical ventilation, and untreated dyspnea may be a contributing factor to. Beyond this exclusive report.